Mpox, formerly known as monkeypox, is a viral zoonotic disease caused by the Mpox virus. This virus belongs to the orthopoxvirus genus, which also includes the variola virus responsible for smallpox. Although Mpox shares similarities with smallpox, it is generally less severe. The disease primarily occurs in Central and West Africa, but has the potential to spread globally. Let us look at the pathophysiology. Mpox is caused by the Mpox virus, which enters the body through broken skin, mucous membranes, or respiratory droplets. Once inside, the virus replicates in the lymph nodes, leading to a systemic infection. The virus causes a characteristic rash and other systemic symptoms. The immune system's response to the virus results in the formation of lesions and systemic inflammation. Classification. Mpox is classified under the orthopoxvirus genus in the Poxviridae family. It is further divided into two classes based on genetic differences. Number 1, the West African, and number 2, the Congo Basin. The West African class typically causes a milder form of the disease, while the Congo Basin class is associated with more severe cases. Risk factors. Risk factors for Mpox include A. Close contact with infected individuals, especially those with visible lesions. B. Handling wild animals, particularly rodents and primates. These are known to be reservoirs for the virus. C. Being in endemic regions in Central and West Africa. D. For men who have sex with men, engaging in unprotected sexual activities with multiple or new partners can increase the risk. Mpox presents with several stages. Number 1, the incubation period. The incubation period typically lasts between 6 to 13 days, but can range from 5 to 21 days. Number 2, prodromal phase. Prodromal phase includes fever, intense headache, lymphadenopathy, myalgia, back pain, and fatigue. Number 3, rash development. The rash usually begins within 1 to 3 days after fever onset, starting on the face and spreading to other parts of the body. It evolves from macules to papules, vesicles, pustules, and then scabs, lasting 2 to 4 weeks. D, or number 4, other symptoms. Other symptoms include severe itching, conjunctivitis, and eye infections in some cases. Investigations. Diagnosis of Mpox involves several key investigations. Investigation number 1, polymerase chain reaction, or PCR. This is the primary method for detecting viral DNA from the skin, lesions, blood, or other bodily fluids. Investigation number 2, serology. Antibody detection tests can be used but are less specific. Investigation number 3, electron microscopy. This method identifies poxvirus particles in lesion samples. Differential diagnosis. Mpox must be differentiated from other conditions with similar symptoms including smallpox, chickenpox, measles, bacterial skin infections, and scabies. Management of Mpox. Management of Mpox includes supportive care and specific antiviral therapy. Prevention. Preventive measures for Mpox include vaccination for smallpox, which provides cross-protection against Mpox. Newer vaccines like modified Vaccina Ankara are also available. Isolation and infection control. Infected individuals should be isolated. Healthcare workers should use appropriate personal protective equipment, and there should be a consistent use of condoms and avoiding high-risk sexual practices. Finally, Mpox is a serious disease, but with timely diagnosis, effective management, and robust preventive measures, we can control and eventually overcome this challenge. Stay informed, stay safe, and let's work together to combat Mpox. Thank you for watching.